Hey cousins, welcome to my channel. I am Courtney Noel, and clearly I am Courtney Noel. If you're new to my channel, welcome, welcome, welcome. And if you are an OD but a Goldie, hey girl, hey boy, hey, welcome back to my channel. Today is going to be a bit of a different type of video. I have the lovely lady, the legend, Miss Deanna Cooper Gillingham here with me. And if you are not familiar, you will be familiar after this video, but she is the CEO of the Case Management Institute. She's a nurse entrepreneur. She's a podcaster. She's an author. She's a case manager. She's just a renaissance woman. So I am so lucky to be sitting down with her to tap into her wealth of knowledge of case management, nursing, and just life in general. So welcome to my channel, Miss Deanna. How are you?
Well, thank you, Courtney. I hope I can live up to that introduction.
You most certainly can. You guys, I had to stop Miss Deanna because I just hopped on the call with her and she was dropping gems. I was like, hold up, we got to save this for the viewers because this is too good to just hold to myself. So she is the author of the book CCM Certification Made Easy. And if you have watched any of my videos, especially the playlist I have for utilization review, and if you want to pass your CCM, you are no stranger. You probably are in her Facebook group, right? Because your Facebook group gives gems, honey. I was stalking that page every day. I was answering those questions. And so you are familiar with her. Miss Deanna, I just want to know, starting out, what made you become a nurse?
Oh, wow. So that was many, many, many years ago. And, I think it's one of those things that I've always wanted to do since I was a child. And my mother had two friends that were nurses, and they were like, don't go into nursing. So out of high school, I went to college for something else. But it was still in the medical field, but it was looking in a microscope all day and it gave me a headache. I'm like, I cannot spend 8 hours a day doing this for the rest of my life. So I dropped out of school. I was like, oh my gosh, what am I going to do? I had no clue. And then one day I just woke up and it was just like, you need to go to nursing school. And so I did. And I have loved it. I identify as a mother and a nurse. Those are the two things that I am. So
Wow. That is a beautiful story. I think it's very rare these days to find people who just say they want to be in because it's not an easy profession to be like you have to. I'm not gonna lie, I did not wake up and say, oh my gosh, I wanted to be a nurse. I mean, what happened with me was that I went to school, I left high school, I thought I was like, oh yeah, I'm gonna be a doctor. Then I started partying, I couldn't keep up with trigonometry, and I was like, well, I might as well be a nurse. So to hear that you just knew is like is beautiful because that means you have a server's heart or servant's heart. And so what specialties did you start out or did you work in prior to case
okay.
management, of course?
Okay, well, hold on to your seats because it's been a minute. Um, I started off in med surge. I actually started off before that. When I first graduated, we went in my area, we went from a nursing shortage. And I was like, oh, yeah, I'm going to go to nursing school. I want to do this. I want to be a nurse. And there's these like huge sign on bonuses. Well, in the 3 years it took me to graduate, I went for my associate's degree and I had like a year of prep beforehand to the way that the school ran. There was a flood of nurses and you couldn't get a job anywhere.
Mm,
So I started off working as a LPN because the school I went to was an LPN/RN program. So I had
no.
both of those licenses when I got out of school. And I would sit with hospice patients and just sit for 8 hours with them as a sitter. So that was my first experience as a nurse. Then I went to med surge, the whole everybody needs to do med surge back in that day. When I don't know if they're still doing that now. I went into oncology. Then I went into home hospice. From there, I went to ICU, which is kind of a big jump. Labor and delivery, back to hospice. I worked in as a patient service representative. So there was these little life vests. I don't know if anybody knows about them. They're like these external defibrillators people wear.
Yes.
I would go and fit patients for those and teach them about those. I was also working in an endoscopy lab. So I have some outpatient experience. And then I got into case management and the rest is history.
Wow. And so when you got into case, at what point did you say, you know what, let me be done with bedside and let me transition into case management? Because I'm not gonna lie, when I was used to work, my first exposure to case management was when I worked med surge, and I would see them running around like oh, let me, and I'm like, I don't ever want to do that, right? I never thought that I would want to be a case manager, but it's like, I don't know. It just it was a natural shift for me. So at what point did you say, you know what? Let me think about transitioning into case management.
I kind of went kicking and screaming. Um, so I was the type of nurse who liked to be in I like the touchy-feely nurse. So if a patient was
Mm-hmm.
having an epidural, I'm not sure if I missed the labor and delivery, but I worked in labor and delivery too. I was the one that was like holding her head on my shoulder and,
Mm-hmm.
while the doctor was putting the epidural in, I love to go in for surgeries and like be scrubbed in and, what other job can you have that you can actually be inside a human body and taking organs out and putting them back in? And, that's
Okay.
you can only do that in healthcare. You can't do that
Yes.
anything else. Like you're considered weird. So I liked, starting IVs, doing dressing changes. And so case management to me was just like, oh, I don't want to do that. I want to be like hands-on patient. I want to do blood draws, start IVs, pick lines, central lines. I liked all of that. And I ended up with an ankle injury that got worse and worse and worse to where I couldn't even be on my feet for 4 hours a day. And even when I moved to the endoscopy lab and I wasn't on my feet as much, it was still really bad. I was having a hard time. And my friend was working as a utilization manager. She's like, girl, you need to get into case management. You would be so good at this. And I'm like, no, I need patients. I need to be around my patients. Um, and honestly, it just got to the point where I could not physically do it anymore. And
Mm-hmm.
then once I moved into case management, I was like, I fell in love with it. It was a totally different type of nursing, but I could see a big impact. So in the hospital, you see them for the couple days that you have them in the hospital, and you have
Right.
no idea what happens after they leave. With case management, I was able to follow them and get them to either back to normal or to their new normal. And that was really incredible for me. So that's my story.
Wow. So when you did case management, did you do like the acute care part, or were you more so like outpatient or disease management?
Good
What?
question. Yeah. So since I couldn't walk, even like in the hospital floor, I mean, I could walk, but I mean, it got to the point where if I went to Walmart and I had to walk from the parking lot back to the milk and back, I had to go put my foot up for a couple hours.
Wow.
So obviously, even inpatient case management wasn't going to work for me. So I got
Hmm.
a desk job working at a company. It was like 45 minutes away, one of the blues, and I worked for one of the blues in an office and did telephonic case management. And like I said, I loved it because I got to see the patient from initial insult or injury up until they were released because they were as good as, they were at their new normal. So I loved it.
Right. I think that that's a big transition too. And how was that for you? Number one, to go um from the provider or from, okay, I'm talking it from the hospital side to
Mhm.
then switch to the insurance side, right? Was
Yes.
that a big switch for you? How did you adjust to that? Because sometimes I think it's ingrained in us to be for the people, right? But sometimes when you work for different companies, there's different objectives, we'll say it like that. So how did you make that switch?
So that is a really good question. It was something I was fearful of. I'm I'm going to say this in public, but I'm surprised that I got that job because when I worked for one of the hospitals I worked with, we had that insurance, and I like actually told them that they were going to give me a stroke because their policies were so bad and trying to get on the telephone lines was so bad. And I was like, you are the enemy, you are the antichrist, you are evil.
Yes, yes.
And then I was like, no, I'm going to work for them. But I will say that the my director had a good what her heart was for the patient. Okay. She was
Hmm.
ex-military and it's all about the person on the other end. And my job was to make sure my patient, my client is what we would call them, knows how to use their benefit to the best. So I considered my job was helping them get the most bang for their buck. you get this insurance, you have this policy. No, you don't have this benefit, but guess what? You have this one over here. And we can just do a little bit of shuffling and we can get you that, but we're just going to have to do it in a different way. And I love puzzles and I love like all that, critical thinking and how to try to figure out how to make something work. I have this personality trait that it's like nothing's impossible. You just got to figure out how to make it possible. And
Listen.
so I did that for my clients. It's like, oh, well, okay, no, you may not have a SNF benefit, but you have a rehab benefit. So we're just going to put you in rehab. You qualify.
Mhm.
And
Mhm.
so I felt like I was there inside. I used to tell my patients when I would call them and enroll them, and they're like, well, what are you going to do for me? And I'm like, I'm going to treat you like you're a family member, like you're my favorite
Mm.
aunt or uncle. And you happen to have somebody, a niece that works in the insurance company, and she's going to make sure that you get what you deserve and what you need. So that was my job. And, if something wasn't covered, I could do a lot of work and write up special cases that we could take and see if we could get them approved if they really needed it and it really met, was something that they need. We don't do this just because, you know, it we have to be mindful of the money runs out.
Mhm. Yeah.
And so, but we need to be mindful that there are people who need things. So there are rules and contracts, and our job is to make sure that the rules are followed, the contract is upheld, but the patient gets what they need.
And I think something that's very about what you just said that's very interesting, and I think I want to bring light to it is that even though you changed settings, you still was a nurse at heart. Because I think that that's what we all have to realize is that we're nurses first, and then no matter what setting you're in, whether that's in the insurance setting, hospital setting, whatever setting, or like you said, in the patient rep setting, it's the nursing part of you that stands first, the patient and their well-being and them being better holistically. And if you take that with you in every setting, you're going to be fulfilled, so to speak.
Absolutely. Yes.
Okay, so
So
at
you
what
nailed it.
point, at what point did you say, okay, well, first of all, let me, when you penned this wonderful book, you guys, it's called the CCM Certification Made Easy. And I'm going to be honest, how I got introduced to your book was actually one of my coworkers was like, I think I'm going to take this exam. And I was like, how are you going to take this exam, my girl? What made you want to do it? She's like, I'm going to buy this book. And I will tell you, that was in I want to say around 2018. I didn't sit for my CCM until maybe 20, did I do it? Maybe around 2020. But I still remember this book. I still remember that this was a book that I needed to get. So how did you come up with the idea and it go from concept to reality?